Okay, and we are here for another episode of the Lowdown. Today, we have another special guest, Associate Minister of Mental Health and Addictions, Minister Michael Tibollo, who's also been on our show with us and taken some live calls. Minister, thank you again for joining us today.
My pleasure being here.
Great. So, let's jump right into it. I think one of the big things that everybody is going through, no matter who it is some type of, whether, it's a clinically diagnosed mental health problem or not. I think everybody's in a state of stress. That's absolutely, I think, certain. And then obviously compounded when people do have some type of other more serious medical issue where it's been diagnosed and maybe it's worse. Those are obviously worse. What are just some, basic recommendations? I think one of the things that I guess we should mention for the audience as well, along with you running that portfolio of the government, you're also working on your doctorate in psychology. So this is not only something that on a government level, but you're clearly working towards an expert level of knowledge. So I think that's a valuable piece of information to share.
Yeah, well, I appreciate that. And I'm working with, I'm doing my doctoral thesis now, and my focus is on recidivism rates, specifically in addictions. But you mentioned that there's a lot of people suffering right now. It's an interesting time to be in a pandemic because we've never really experienced this. If we wanted to compare it to anything on a global scale, we'd have to think about something like one of the world wars or the Great Depression. So we as individuals, most of us have not gone through those really difficult times to be able to even understand the impact of something like this. But the Angus Reid poll that came out last week was really interesting because the statistics showed that 50% of the population in Canada has an issue with anxiety and depression right now. And the demographics around which cohort of people is experiencing it the most. It's interesting as well to note that it's women between the ages of 18 and 54. And I would expect that that's probably because the women are the ones that are bearing the brunt of the stay-at-home situation with looking after the kids that are not in school, looking after the parents or being concerned about the parents that are alive, that are either living on their own and being unable to go and assist them and to bring them the things and have the meals that they used to have. And of course, the ones that are living in the long-term care and the situations that we're seeing there because of the outbreaks. So it is impacting pretty much everyone. And if it's not impacting on you directly, it's impacting on someone that you know, that you care about, or that's in your circle of friends. It's not easy to be, at home isolated. I keep on saying when we started this whole thing, we used to hear all the time, socially, distancing. And I kept on saying, let's not talk about social distancing. Let's talk about physical distancing.
Yeah.
Because what we don't want to do is social distance or socially isolate individuals. And we see that, in our seniors, the impact in the normal course, seniors are isolated and feel alone. So you add now the fact that, the kids aren't going or the grandkids aren't going to visit or they can't go out for a visit themselves. It multiplies exponentially the pressure on individuals. And then you're in an environment that is difficult as well. It just compounds and makes living more difficult for older people. So one of the groups that we need to be careful about and make sure that the supports are there, whether it be through social media, whether it be through, going to the parking lot and waving to Nona or Nono up on the third or fourth floor. I think it's important that we maintain the social contacts, even though they are different than what we would, have been doing in the past.
Yeah. So I think two things really stand out there. Number one, the point you made about the females. My wife, who is still working, but she's working from home. We have a 15-month-old at home. So she's, and I have to be honest, I'm not the best in terms of being a caretaker and things like that. She is much better at it. So she's doing double the work because typically my son would be in daycare. She's now having to do her job along with taking care of our son, which I'm also here doing it as well. But it's been extremely difficult for sure. And that is definitely a layer of stress that I think you can only really appreciate if you have to go through it to try to be on work calls, to do things like as an example right now, because my son makes a lot of noise, they're on the third floor of the house right now so that we can have space, so that I could do this with you, not be interrupted. It's an extra challenge. And the other thing that I think is and I sort of was saying the same thing, that term social distancing. Physical distancing is a much better term, because socially, I mean, when we put people in prison as punishment, that's social isolation. Like, that's what we do to humans when we're trying to sort of teach them or punish them or things like that. It's what you would do to a kid, go stay by yourself for a second. Like, as humans, we have a need to want to be social. And I think it's really important, especially like you said, for my mom, who's 70 years old, we still have done what you've suggested there. We're being cognizant of making sure that we're physically distancing, but on nice days, we've gone to her house, or she's come here from the driveway. We can be 10, 12 feet apart, have a conversation, even 20 minutes or so, just to sort of keep that relationship going. But I think that's an important, really, really important point, that you don't want to focus on social distancing. And I get why they call it social distancing, but I think you're right. I think a better term is physical distancing.
Yeah, and Lou, it's not going to be long that we're going to start opening things up, and people are going to be able to go out again and do things. I'd like to continue using that word,
Yeah,
physical distancing, because at the same time, as we start opening up the retail stores and the garden centers and people in parks, we have to respect those distances, because it isn't over.
yeah,
We're looking at the numbers every day. I'm sure you see them as well.
yeah,
Our numbers of people that are dying as a result of COVID are not coming down, and they won't for a while, because this is still the outcome of the last 2 weeks. But we're starting to see a reduction in terms of the active or the positive tests with COVID. And when we go back to whatever our routines were, we're gonna have to be cognizant. When you
yeah,
touch that door handle that another 30 people went through at some point, or 300 people went through, you've got to be cognizant of where your hands are. Are we going to see people wearing gloves? Are we going to see people wearing masks, going to and from stores, to and from office to their car, or between offices? I would say yes.
yeah,
We're going to continue seeing that. We're going to continue seeing that for some time. So respecting the physical distance between us is important, but we should continue talking to each other. You can still have a conversation with someone if they're 6 feet away from you.
yeah,
Maybe not a private conversation, but then again, if it's worth saying, you should be able to say it in the open, right?
yeah, exactly.
Um, so there's things that we can continue doing, and I'm mindful, very mindful of number one, where we are today. And you and I had spoken, I think, just before we launched the roadmap to wellness, the
Yeah,
strategy for mental health and addictions in the province of Ontario, and we were already starting to build in aspects of how to help people with mental health issues, with addiction issues. And we looked across government. We actually are working with 16 other ministries when it comes to mental health and addictions. We've put a strategy in place. One of the things that the pandemic has resulted, or a good thing, if we can say that a good thing can come out of a bad thing. And I think, we both deal with people that are suffering and have difficulty. And I love the analogy that the glass is always half full. I
yeah,
don't look for ways to, describe how the glass is half empty. I think we have to look at what we can get out of whatever experience or
yeah,
situation we have. And that's part of how I deal with my mental health. But we're in a situation that is extremely difficult. And, it's a game changer from the standpoint of how we do things. So from my standpoint, even though it's happened, the pandemic, and we have to deal with it, we have to be real about it. One of the things that we've gotten from it is the fact that it has given us an opportunity to improve the way government delivers business, and how businesses deliver services to individuals as well. I mean, I can tell you that health has been transformed, as well as mental health, as well as our judicial system, as a result of us unable to come together, whether it be for hearings that have to take place in the courthouses, even in terms of care and the development of virtual care that, we have evidence-based studies that show, for instance, in mental health, that a lot of therapies can be delivered via the internet, always under the supervision of a clinician, but they can be delivered that way. And that's
Yeah.
really, if there is something positive to take away from this whole situation, it's that the reformation and the transformation in government is huge. And it probably wouldn't have taken effect for 10, 15, even 20 years if it hadn't have been for the pandemic.
Yeah, and I agree with you. I think that's a very wise thing to understand for anybody, that in life, whether it's a pandemic or anything, but there's always going to be bad things. And I think one of the difference is that any individual can make is, yeah, you can either take it and make it the worst thing in the world for you, or as a people, we can make this and learn from it. And some of the points you bring up there, one of the things, obviously working in healthcare myself, I was speaking to a colleague of mine who works in the emergency room, and we were speaking about just the incidence of appendicitis, for example. They have seen less appendicitis than they've ever seen. And so that's interesting, because you would think, well, that really should not decrease. And so we sort of were hypothesizing, it's maybe related to stress levels. Maybe more people get appendicitis when they're more stressed, when they're in their busy lives doing things. I don't know. That's sort of a me thinking out loud. And then the other thing we thought of is, to some extent, in healthcare, we do create our own work. And so, and the reason why I bring up appendicitis is I actually had to send my niece there because she was having a flare up. Or what we thought was appendicitis. And, when she went there, she got the ultrasound, and the ultrasound showed that the appendix was on the larger limits of normal, right? And so really the way they managed it is said, okay, go home and keep an eye on it. It resolved and she got better on her own. And we were sort of talking about this, and it was like, prior to COVID, they probably would have just taken out her appendix, right? Like it would have just been something. And that's, a lot of things, that's whether you want to call it a need. I don't think it's needless. I mean, the risk is very low, but it's a surgery to a 7-year-old girl that maybe doesn't need it. Maybe they do resolve on their own. And so I wonder if this is sort of teaching us some things. Now, some of my healthcare colleagues might hate me for bringing up the point that we create our own business to some extent, but the reality is that we do. And maybe this adaptability of, being pickier, using different ways to manage things, may be something that we could take out of it.
Yeah, it's an interesting comment. I mean,
Yeah.
I'm sure there's going to be all kinds of studies that are going to come out as a result of this. How do you go from a hospital system operating at 110,
Yeah.
120% capacity, now functioning at about 60%
Yeah.
capacity, which means there's lots of room in the event that the beds are needed for the pandemic. Now,
Yeah.
part of it has to do with the fact that a lot of the elective surgeries are being put off. But if you were to put those surgeries back in, would it cause the surge to 120%? And that's the first question. The second part of that question is, we know that emergency room use typically is between 1 in 5, 1 in 3 are people coming in with a mental health issue.
Mm.
Now, how are those issues being dealt with? Because we're not seeing those going into the hospitals, and
Yeah.
they contribute great deal to hallway medicine.
Yeah.
So, is there something of resiliency that we have innate within us that is that comes forward in situations of emergency and crisis? So the statistics, just to follow up on that, the statistics show that 90% of individuals in a situation where they're put through a crisis or they're putting through an emergency. So for instance, 9/11, the flooding that took place in New Orleans, the larger kind of catastrophic type situations, 90% of the population rebound, right, because of coping mechanisms and resiliency that exists within them. And it's only about 10% of the people that have either a post-traumatic stress disorder or one of the more intense traumas that results from higher levels of anxiety. So we're in a situation right now where perhaps the majority of people are seeking help, and they're able to use that resiliency. They're utilizing things like Connects Ontario. We've seen the numbers increase in terms of usage. They're using Bounce Back, which has programs for them to be able to use to help them build those coping skills. We have the talk for the high school students. We have the talk lines for the youth, the call-in lines. They're all increasing in terms of usage. Now, is that enough to kind of act as a tune-up to help that individual cope with the stress? And as a result of that, we're not seeing an influx into the emergency rooms of the hospitals. And if that's the case, and we've now started conditioning people to use these support lines, then maybe we've found a solution, which we believe was a problem before. We found a solution in diverting that traffic away from the hospitals to utilize the helplines. We just announced yesterday, it's very timely, we're in Mental Health Week, so it's great to be having this conversation with you today. But at the same time, we've also announced yesterday the use of internet-based cognitive behavioral therapy. And that therapy, there have been it's evidence-based, and studies have been done that show that it is just as effective as face-to-face cognitive behavioral therapy. Now, in the Roadmap to Wellness, we talked about use of cognitive behavioral therapy and Mindability, the program of structured psychotherapy that's going to be delivered through OHIP across the province to anyone who needs, he or she needs that help. To now have implemented as quickly as we have, it's a direct result of the pandemic. So again, another silver lining, shall we say, for that cloud. But it's forced us to make sure that it gets started immediately, and it started today. And I've actually already started getting statistics back that people are calling, looking for those support services where they can self-assess. Then there's modules that they can complete themselves. It's under the supervision of a trained professional for cognitive behavioral therapy. And it's open to anyone. And the government, as was mentioned by the Premier, we are not going to stop supporting the supports to individuals because of deficits or because of trying to hold back on spending. We are going to do what's necessary to keep our population healthy, both mentally and physically. Because again, you've heard me say this, if you want to be healthy physically, you've got to be healthy mentally. Mentally, it determines your physical health. So it's really important that we get this right, and that's why the investment. And the other announcement yesterday that I'm really happy about is that we have now a mental health command table. And a lot of people may not understand what that is, but what we've done in government is we've looked at the different aspects of both how to manage health, how to manage the PPE supplies, so the personal protection equipment, how to manage the economy, and all these different tables meet. And it's not just cabinet ministers or members of provincial parliament. It also includes the stakeholders. So, for instance, we now have a mental health command table that has at the table all the major organizations across the province of Ontario that are delivering services to Ontarians. We're gathering data on a daily basis, analyzing it, and trying to determine where the gaps are so that we can provide additional supports to help people. And we're feeding into all the other tables. So when we start talking about business, well, there's a whole component of business psychology that needs to be addressed to make sure that we're providing the proper supports to people, to entrepreneurs that could potentially lose their businesses, need to find ways to refinance and restructure and repurpose what they're doing. So we're there to provide those supports through our command table for mental health and work on an integrated basis, which is what government should do, and not be in these silos the way they were in the past.
Yeah. So yeah, a lot of great things there. I definitely want to come back to cognitive behavior therapy and the link between mind and body. But on one point that I think was really interesting about the emergency room visits, my role, a lot of what I do is in the physical medicine and the physical health side. And even in that respect, one of the things that I often advocate people to do is also be better consumers of healthcare. Right. So understanding when you should go to an emergency room, when you should go to a walk-in clinic, urgent care, when you should see other paramedical professionals like chiropractors, physiotherapists, or on the mental health side. And that segregation of understanding that, I think COVID is doing something to maybe teach people that, where they're I've had people call me on the radio show and say things like, I had, you know, one person call saying they woke up with a droopy eyelid and all these things. And I was like, well, you have to call the hospital right away if you wake up with something like that. And they were like, well, I thought hospitals were closed, right? And so and now that's a dangerous thing too, right? We want to make sure that we don't discourage people from going to an emergency room when they need to. But I think there needs to be some understanding around the difference between urgent, emergent, and things that can be dealt with. Dealing in the physical health space, the amount of people that we have with chronic low back pain, that when their back pain flares up and they go to an emergency room, that's a waste of emergency room resources. And they typically will come see us after and say, oh, I went to the emergency room. They didn't do anything for me. It's horrible, blah, blah, blah. And it's like my job always becomes, well, that's not what they're designed for. They're not there to manage your chronic low back pain or your chronic knee issue. That's not the best place for it. What they're really looking for is someone in a life-threatening state that they need to intervene. And so I think this is good. Again, I agree with you on the silver lining. I think we need to sort of figure out a way where we don't discourage people from going when it's absolutely necessary for more serious things, myocardial events, strokes, those types of things, which is a dangerous thing. So for sure, there needs to be some clarification there. But moving into, before we go to cognitive behavior therapy, because I'm a huge fan of that, and we do a lot of that work as well, that mind-body connection, like where you said, I mean, one of my undergraduate degrees in physical health and education, and one of the things that we were consistently taught in the research that I've done is that link is so strong that almost to segregate it and say that one is one and the other is other is very, very wrong. I mean, there's research that shows that, and I've been recommending to people with mental health stuff as well, that good research shows that even something as little as 30 minutes a day of moderate physical activity, whether that's a nice brisk walk, raking leaves, whatever it is, just where you're getting your heart rate up to about 60% of maximum or something like that, does show to decrease things like depression and anxiety. And so one of the things, and a lot of my work is in chronic pain, where you're dealing with this silo of pain, depression, and poor sleep. And one of the first things that we do in our programs is we just get people to start walking, because the amount of people that are dealing with these types of issues and just completely isolate themselves and don't do anything, it's not good. Our bodies, that link between mind and body is one thing. It's not two different things. And we need to be working on both ends, I think. And it's great to see that more and more mental health stuff is being incorporated, because I think people can sort of appreciate the body stuff, the physical stuff more, because it's evident, you can see it, you can do it. Whereas on the mental health side, but that link is incredibly important to understand.
I agree with you. I mean, everything you said is bang on in terms of what needs to be done. The physical side of it is important because it helps the mental side. The mental side is important because it helps the physical side, and they kind of work together. And there's some amazing work that's been done. I'm not sure if you're familiar with Norman Doidge, the professor at U of T.
Got his books back there.
So do I. They sit on my desk. The neuroplasticity of the brain and utilization of the mind to reconnect pieces as a result of damage caused by, you know, a stroke or by, you know, a heart attack, shows the power of the brain. And if we can harness the brain, what the potential is. So they're so interconnected that, you know, to me, I'm still shocked that, you know, we talk about health, and we've never in the past talked about mental health. And you know, when I came to government, that was I felt my obligation, my duty to come and make sure that it was something that was at the table, regardless of the ministry that's involved, whether it's the seniors and, you know, children and youth and social services, housing, you know, education, that all of them understood that mental health has to be at the table. Because if it's not there, whatever you do, those other components will never address truly the individual and that individual's ability to be healthy mentally and physically in whatever environment is created.
Absolutely. And Norman Doidge, one of the interesting things that he brings to light is the work by Ram Chandaran, who works with phantom limb pain. And I think I talk about this a lot on the show and to people, because I think it's the clearest example of highlighting how strong the mind is, that people with a phantom limb, due for whatever reason, can still feel pain in something that is physically not there. So I've seen people, you know, who will say they might have their arm gone, and they say that their thumb still hurts, and they're not pointing to where their arm stops. They're actually pointing to the space where the thumb would be, and it's not there anymore. And so I think that work absolutely highlights the idea of, and I tell everybody this, the things, especially dealing with pain and what we do, pain is a perception that's created in your mind. In the physical space, if I sever someone's spinal cord, I could burn their lower body with fire and they would never feel anything. That's how we test for pain sensation and these things, to make sure there's that connection. So that subjective experience of what we feel in our bodies is a result of everything that's being integrated in our motherboard, which is our brain. And it's interesting because one of the other things I go on to explain with patients is that area of the brain that controls all this stuff, the limbic system, is an area of the brain highly involved in emotions, right? And so it makes sense why when, you know, all of a sudden you're having a bad day in times like this, you know, we're going to see issues of mental health, but we're equally going to see pain rise during these times, because those systems are so interconnected in our motherboard, in our brain, that as your emotions are heightened, your body feels worse, and everybody appreciates that. I mean, one thing that I always say to someone is when they come in with, you know, aches and pains, I say, you know, if you found out you won the lottery right now, I bet you'd be doing cartwheels, and that because that euphoric feeling, that happiness would sort of take over. And we've all been sick with a cold or something, and your body feels worse. That connection is there, and it's real.
Yeah, and it's interesting again with Dr. Deutsch. His work is, from my standpoint, an addiction standpoint, is fascinating because he demonstrates with the research that he does and the work that he does that the brain actually can rewire itself,
Yeah.
so that in the event that you suffer a catastrophic incident in your life, you can be taught to to walk again, or to have a functioning limb again. But from the standpoint of mental health and in addictions, a lot of people feel that they can never get off substances, and they're doomed to spend the rest of their lives in that particular mode because they fried, or that the circuit board is burnt on that spot. Well, the good news is, based on his research and his findings, that we can rewire the brain to circumvent that particular part of the brain and still have the functions that that we had previous to an addiction. So I use that as a way of saying, look, we can help you break a habit. We can help you find your path forward without the use of substances, and we can make a difference because the brain is elastic that way. That neuroplasticity concept to me is something, it's new. It's something that he's adopted and brought forward, and it's going to be huge in terms of the reconnection between physical and mental, but also in the way of how the brain can rewire itself so that it can function, notwithstanding the fact that it may have been damaged as a result of a substance use.
Yeah, and I think that's a perfect segue into the cognitive behavior therapy, because a lot of what cognitive behavior therapy tries to do is also create some level of plasticity and changing your thoughts to in turn change your behaviors. Can you take us I mean, I know what cognitive behavior therapy is. Listeners and viewers may not. Can you take us a little bit through cognitive behavior therapy?
Well, I've spent time with cognitive behavioral therapy as part of the work that I used to do with the residential therapeutic community. We had individuals that would come in. They'd have negative feelings and emotions. They would, not really be in a good place from the standpoint of, socializing. They would typically have behaviors that were questionable, but necessary to kind of continue the existence that they had. So what cognitive behavioral therapy does is basically makes the person see and understand in the here and now, the present, what the person is doing and the impact of what that person's doing. And it uses great techniques. I mean, I love the idea of giving the person, the individual, the time to reflect on, why he does things the way he does them, or why he behaves the way he does, and repeats the habit, notwithstanding the fact that the result never changes. And how can you change the result? By changing the behavior. So it's great. It's typically time limited. The process that we're putting in place with Mindability, that's going to be available to everyone in the province really is focused on mild to moderate anxiety and depression. There are situations that are more intense that require, a greater
Yeah.
amount of time and face to face. But the model we have for the province is the one that's based on the structured psychotherapy that was created in England. And I had the privilege of meeting the two gentlemen that 13 years ago implemented that IPAT system in England. I sat with them. I got to listen to their concerns about, pitfalls. One of the things 13 years ago that didn't exist was virtual
Yeah.
care, which is something they said, they wish they would have had it. They had a huge problem in England, and I think they're at about 50,000 therapists now that are delivering after 13 years. We're very lucky in Ontario because we have a solid base of like, masters of social work, nurse practitioners, and psychologists and therapists that are psychotherapists that are all trained in CBT. I would hazard a guess that we may have as many people in, and I don't have a statistic on this for sure, but I know we have, for instance, 30,000 social workers registered in the province of Ontario. So we may have the capacity to be able to jumpstart the whole mindability program a lot faster than they did in England. We've invested a substantial amount of money, I think about $20 million into that. That's in addition to the 12 million that we've invested during this pandemic time, but that's invested in terms of when the mindability rolls out. And as I said, because of the circumstances with the pandemic, it's rolling out a lot faster and a lot sooner than we anticipated. So cognitive behavioral therapy, to sort of wrap it up, is an evidence-based therapy, which means it is been proven to be successful and help individuals. The Mindability program that we're launching in Ontario has a 50% success rate with 15, so all symptoms are resolved, and 15% have a notable improvement in their conditions. So there's a lot of people that are practicing it. It's a good thing to do. I hope with your good work, with things like this podcast, and a lot of the work that other people are doing as well, Bell Let's Talk and other organizations, we can get over the stigma, because I still believe the biggest issue we have for people coming to see you or coming to use some of these therapies is that somehow they feel that if there's something not working in their minds, they got to suck it up and deal with it.
Yeah.
And they wouldn't do that if they had a broken leg, right?
No.
They'd run to the hospital to get it set.
Yeah.
Well, you have to run to a hospital to fix the issues that relate to the mind.
Yeah.
And if you exercise it and you do it, I used to always say when I was teaching martial arts that the brain is a muscle.
Yes.
And it isn't, it's an organ, but
Yeah.
I used to say it's muscle.
Yeah.
And it needs to be exercised the way every other muscle in the body needs to be exercised.
Absolutely.
Now that doesn't mean it's got to do push-ups and sit-ups, but what it needs to do is it needs to be challenged. It needs to be asked those types of questions. Why am I doing this?
Yeah.
Why am I continuing in this habit when I know the result is going to be the same? The definition of insanity, right?
Yeah.
Keep on doing the same activity over and over again, hoping you're going to get a different result. It isn't going to happen. So focus on fixing that. And that's one of the things that CBT does. And some of the cognitions, the thought processes where an individual is feeling anxious or feeling depressed, understanding what is bringing that forward, and exercises that can be done to reinforce. And that's why CBT is great, because it's a homework-based therapy that allows the individual to work on himself, and if the individual and then find the strengths within himself or herself, and then utilize those strengths to bring them to a new individual, to a new you, or to the you that isn't going to be influenced by the environment anymore, because you've built the coping mechanisms and the resiliency that you need to go forward.
Yeah. And so I want to give one case example of cognitive behavior therapy. But when I do, I think that last point that you made, where it puts it back on the individual to do their exercises, again, in the physical health world, one of the things that we talk about when people have these types of chronic issues is the idea of active care. So you can go see somebody to push on a muscle or do something as much as you want. But really, if you don't take an active component in doing the right exercises, doing the right things, the outcome is not very good. And we're starting to see that with both physical and mental, that it's that active component on the part of the individual to change something about themselves that really benefits. And one of the classic examples I give of cognitive behavior therapy is myself. So somewhere in undergrad, I developed some type of social anxiety, a phobia of public speaking. And I remember going to see my family doctor about it. And I was given some type of a lorazepam, some type of an antidepressant that he just sort of said, take when you feel anxious, but it wasn't getting to the root of the problem. And I remember being in first year undergrad and thinking, this, like, I cannot go on like this. This is crazy. I constant feelings when I have to do presentations and things like that. And I found the psychological team at U of T, and they introduced me to cognitive behavior therapy. And it's hard work, right? Because again, it's about you changing your thoughts. It's about identifying things that are not factual and replacing them with factual information. So one of the things that I used to work on along with my psychologist was, well, what is it that you're afraid of? Well, and I would say things that were unrational, like, oh, I'm afraid of people laughing at me when I speak in public, or I'm afraid of something. And then the reality is, well, put yourself in that situation, see what happens. And then I would put myself in those situations. It was like, well, nobody laughs at me. And over time, you start to all of a sudden change these ideas that are not confounded in any type of factual information, but really are rooted in our primitive brain of fight or flight. And you start to change them with what the reality is, that most people don't laugh, they don't do things, and it's an ongoing process. But fast forward 12 years later, I host a radio show where I speak to tens of thousands of people. I lecture to students hundreds at a time. I've done talks to hundreds of people at a time. I've overcome my phobia. But what I always tell people is that you don't cure something because it's still there. It's about that continual work to do these things will keep it at bay. And if someone said, well, do you ever get nervous anymore? Of course I still get nervous sometimes. Like that goes without saying. But I understand that I've been able to change my mindset in understanding the behaviors, and in doing so, I'm able to carry out and enjoy my life and do the things I want to do. And we use a lot of this cognitive behavior therapy with chronic pain patients in a similar way.
Yeah, it's really interesting. I mean, the analogy that I always use was I had that same kind of fear when I was in high school, and I used to always say to myself, I've got to do more to break it. So I started debating, and then I got involved with the theater, the plays. And I remember one day, I missed a line. I forgot a line in the play, and I thought to myself, what a disaster. But what ended up happening was it kind of just adapted and it went on. And then afterwards, I was really kicking myself for having missed the line and not having memorized it properly. And then someone pulled me aside and said something really profound. He said, the only person that knows that you missed that line is you, and perhaps a director who's following the script line by line.
Yeah.
But life, right, is like the theater. In your mind, you are already seeing what the outcomes should look like,
Yeah.
and you move towards that. But the audience that is watching, or that's part of your life, is just waiting for you to talk.
Yeah.
So when you think it didn't go the way you wanted it to go, or you think what's really happening is it's just unfolding itself, and in the universe, in the grand scheme of things, it doesn't matter
Yeah.
that line got missed. So I always say to people, don't think of this. This is the theater. And you know what? Every once in a while, you will ad lib in life. You have to.
Yeah.
And you have to accept that, because everyone around you will accept that on the basis that they don't know what the script was. Only you do. So don't worry about it. Focus on getting your message across, doing the best you can be, because that's you. That's your personality. Um, you know, I wanted to say that it's really important for people to understand how important it is for them to get the help when they need it. A lot of times parents don't want to deal with issues with their children because they think they're going to grow out of them. A lot of times, mothers are dealing with very stressful situations and they don't talk about it because they feel embarrassed. And this issue of stigma is something that, I hate to say it, but when I was doing a lot of work in addictions, parents would let their kids die because they were afraid that someone would find out that the son was using a substance.
Right.
We have to get over that as a
Yeah.
society. As I said, life is not about perfection.
Yeah.
Life is about living and experiencing and building ourselves to fulfill whatever it is our purpose was for being put on this planet. And that's only going to come when you know who you are and you understand that the environment that's impacting on you is going to always try to take you off that course. But once you channel your energy physically and mentally into the direction that you want your life to go, it's amazing how some of those distractions fall away and you're able to then focus and the energy that comes back to you to take you the direction you want to go.
Yeah.
The reason that I'm here, the reason that I came to government is not because I wanted a career change. And you can tell from the white and the beard here that I've been around the track a few times. The reason I came here was because I really wanted to get people to understand. And I wanted to be at the cabinet table to make sure that the cabinet ministers understood and the premier understands. And believe me, he gets this as well. Our mental health is so important and it ties into, when you were talking about physical pain and the work that you're doing and connecting the two together to make sure that a person is is healthy. In the ancient Latins, what was it, mens sana corporate sano? You
Yeah.
need to have a sound mind and a sound
Sound
body.
body. Yes.
And how do you bring that together? I mean, they knew that thousands of years ago. Somehow there was a disconnect that was created um, in government. When we look at the type of organizations that exist out there from the standpoint of the delivery of services, we've noticed that a lot of organic organizations have come into existence that are doing a lot of the heavy lifting when it comes to helping people with mental health issues. When we're dealing with human trafficking, when we're dealing with domestic violence, a lot of that work has been done by community-based, organically grown organizations, and they're doing a heck of a job helping people. We now have to take the next step as government, and that's why I was made a minister focused on this. It's because it's time that government recognizes the work that's being done by the institutions, so all our hospitals and the work that's being done by the grassroots organizations, and connects the pieces so that we have an integrated system that's going to help individuals focus on getting better, regardless of where they are in their developmental time frame in their lives, and supporting people that have neurodevelopmental disorders and other communities that have specific needs that really, because of the siloed approach of the past, have lost the opportunity to move forward. So it's a huge challenge. I love what I do, and I really appreciate the opportunity to chat about it with you and put out the word of what we're doing, and to let people know that there is hope.
Yeah.
Even during these difficult times, we're going to get through this, and our strategy is going to continue to evolve and develop. And I'm looking forward to continuing the work that we're doing in the ministry.
That's great, Minister. I think that's a perfect way to wrap this up. I appreciate you being here with me today to speak with me. It's getting close to lunch, and we're both two Italian boys. We're both going to need to eat. But yeah, I think the work that all of you are doing and the work that you're leading is incredibly important. Mental health is health, right? It's, we shouldn't even be distinguishing these ideas. It is part of it. And I think there is still somewhat of a stigma, and it needs to get over it. And you're absolutely right. If somebody had a fractured, knee, they wouldn't not tell someone about it. And this idea of mental health and addictions being stigmatized, things happen. We are not, as humans, none of us are perfect. And this is a reality of living. And I think the more that we can each individually do understand and not be like, there was once upon a time in my life where I wouldn't have even told the stuff about my social phobia, right? Because it was something, but now I share it openly because I think it's something that should be shared open. So Minister Tibollo, Associate Minister of Mental Health and Addictions, thank you so much for being here with me today.
Thank you very much. Stay strong, stay safe, and God bless. Thank you.